Alright, so getting started back, we've got two more sections to go through, and in this section we're going to talk about factors altering drug responses. And some of the factors are listed here, which include age, body mass, sex, environmental conditions, time of administration, genetic factors, and psychological factors. All of these can do things to the person who is receiving the medication that will make the medication's intended effects not be quite what you may have expected. So, like I just said, many variables influence these drug interactions. So what you want to do is know how medications affect the patient and other medications previously administered. So if you're administering multiple medications to a patient, you want to know how they interact with each other. For instance, I think in the video it may have, that you saw earlier, it may have talked about how we may give promethazine or Phenergan along with morphine or Demerol to enhance the effect of the Demerol. So it's like a synergistic effect, and it makes it more potent. So you want to make sure you know if the patient is taking some medications that could potentially enhance the effects of the medication that's being given, because it may cause an adverse outcome of that patient. So many patients take several medications each day. We call this polypharmacy, and we see this in our elderly population. The elderly sometimes take 2 grocery bagfuls of medication. And this is where you can sit down and you can find out what type of medical history they have, what medications they're on, and look at the side effects of the medication. And quite often you'll see that the side effects are all combining to cause certain problems, like the patient may have syncopal episodes, they may have bouts of constipation or diarrhea or stomach cramps, and so on. And it'll help you to understand different types of things to anticipate when you have patients who are taking these different types of medications. Many times I've gone out on calls and I have looked through a patient's medications and looked at the signs and symptoms and found out, well, these 3 or 4 medications were just added a couple days ago, and now the patient is complaining of XYZ chief complaint. And whenever I look at the chief complaint versus the side effects of those medications, it ends up being that the problem that the patient is having isn't so much an acute illness, it's more of a side effect of the medications that they're taking. So sometimes we have the predictable responses, like I was talking about with the Phenergan mixed with morphine or Demerol. Well, we can predict that as a response. But then we also have other predictable responses, like we know if we give epinephrine, it's going to dilate the bronchioles, it's going to increase the heart rate, it's going to constrict the vascular system. We know if we give Benadryl, it's going to make them sleepy. If we give them a narcotic, it might make them uneasy on their feet. They may not be good on their feet, so we may have to make sure that they are sitting down because they may be under the influence of that medication. And it may be what we're wanting to happen, and it may be something that we're not wanting to happen. However, sometimes there are some unpredicted responses, one being like an allergic reaction. This is the most common one, and you should assume that it is a possibility anytime you give a patient a medication. So be ready for it just in case. The thing is, though, for an allergic reaction to take place, is usually the medications, the patient should have been exposed to it previously. So sometimes if you give the patient a medication and you ask them, well, what are you allergic to? And they tell you, well, I'm not allergic to that. And if you ask them, well, have you had it before? And if they tell you, well, I've had it once before, well, then there's still a chance that they could have an allergic reaction against it. Alright, some other unpredictable responses can include serum sickness. And serum sickness is something that I haven't heard of very often. However, serum sickness includes see my notes here, a condition in which an antigen antibody complex is formed in the bloodstream, deposit in sites around the body, most notably in the kidneys, with resultant inflammatory reactions. So serum sickness is kind of almost like one part of an allergic reaction, whereas you've got some inflammation that's going to pop up somewhere. Idiosyncrasy, now this is like an over-exaggerated response to the medication that is rare and only really comes out in that person. So you may have somebody where if they take a narcotic and it may only take a little bit to really achieve the effect that you would normally be looking for. So a peculiar or individual response to a drug or medication through unusual suspectability. So like for myself, I can tell you for myself, it does not take a lot of pain medication to help alleviate my pain. Typically, Motrin does a really good job. Toradol does a good job for me, and so on. Whereas someone else may need morphine. Tolerance, this is what patients will build up, a tolerance to medication, especially if they take it on a regular basis. So if you have patients who are taking pain medications on a daily basis for months, weeks, or years or whatever, then it's going to end up resulting in them needing higher dosages to achieve a desired effect. A cumulative effect, this happens whenever drugs are giving in successive dosages, and what happens is the effects of the drug are compounded. Now, instead of having given the patient 5 milligrams, now all of a sudden the body has 10 milligrams available to it. So you're expecting a 5 milligram response, and in reality they're getting a 10 milligram response. And then there's drug dependence. Now this happens with prolonged administration of a medication. Now for us in EMS, we do not really have to worry about that because we're not going to be giving patients a dose after dose of medications where they're going to become dependent. You can also have drug interactions. This is where the effects of one medication alter the response of another medication. And we found this happening whenever we were giving a lot of antiarrhythmic medications in cardiac arrest. And they were counteracting each other, making things worse. So now in advanced cardiac life support, we kind of try to stick to one. And the summation effect, this is where everything is going to, when things add up, like whenever you're giving multiple medications. So this is the increased effect that may occur when two drugs that have the same or similar action are given together. So if I'm giving you morphine and fentanyl, well then that could actually decrease your respiratory drive quicker. Well, that concludes this section of the lecture. We've got one more section to go, and then we'll be done with Chapter 7.